I'm interested in your opinion about the correlation between long-term Hashimoto's disease and high cholesterol for somebody who's followed a whole food plant-based diet, SOS-free, for many years.
Okay, so everybody did hear that. Hashimoto's is an autoimmune thyroid disease that can create low thyroid, hypothyroid, but you can actually have normal labs for a while, and rarely you actually have elevated labs, hyperthyroidism. There can be different phases. It's autoimmune. That means there's antibodies to the thyroid. You can measure them. They're called anti-thyroglobulin antibodies and TPO antibodies. We're not certain why you get antibodies. You'd like an antibody to your pneumonia bacteria. You don't really want an antibody to your thyroid. There's a theory that Hippocrates, and all disease begins in the gut, that you may be eating food or have a condition or a deficiency that lets gut contents, and gut contents aren't really lovely things. They were when we first ate them, but by the time they get in the colon, they're not so pretty anymore. But gut contents spill into the bloodstream, the body reacts, antibodies are made, but oddly they cross-react with your thyroid. There's a theory, there's far from any convincing data, that in some people gluten can leak across the wall of the gut. We get an antibody, it's not full celiac, but the antibody reacts with the thyroid. And there are some natural health experts that recommend trying a gluten-free diet for Hashimoto's thyroiditis. When you're in the phase of Hashimoto's thyroiditis that you're low, you're hypothyroid, hypothyroidism of any cause, not just the autoimmune cause, maybe you've had your thyroid out because you had a nodule and it was radiated as a kid. But if you're hypothyroid, cholesterol goes up. And that's the main risk of developing coronary artery disease and atherosclerosis is high cholesterol. I do see people that come in, their cholesterol is 270, and they don't know why, but we do a full panel, and they've got hypothyroidism untreated. You treat the thyroid condition, and the cholesterol comes down. You didn't need Lipitor. You needed Nature-Throid, or you needed Synthroid, or needed a little iodine. You can measure a blood iodine level. So that's the main connection. Just since this is a natural health conference, this has not been a topic, but there is a boatload of high-quality science data about the health benefits of exposing yourself to red light. It's called photobiomodulation in the science, and there's more than 1,000 articles in Animals and Humans, many of them done by Harvard scientist Michael Hamblin, MD, with textbooks on photobiomodulation that thick. That's how much science there is. There are actual published human studies of sizable numbers, 40, 50 people, exposing your thyroid to red light because it can penetrate the skin, and near-infrared light, and these are actually now relatively inexpensive panels you can buy, can actually cool down and convert the thyroid immune system to quiet, and there are people who have gotten off their medicine permanently by that. I think that's ultra cool. So I'm a big fan. I have a red light panel in my house I use every day I'm at home, not for my thyroid specifically, but for general health. Maybe we'll have a red light therapy vendor here next year because the science behind it is sufficient to meet any academic criteria. Okay.
Hello.
Hello, Doc.
You go, and then we'll get you.
Thank you. First of all, I want to thank you for that outstanding conference. I'm glad you're the last speaker because my mind is swimming with all the beautiful data you gave me. So thank you once again. I've got 3 short questions. One, you mentioned 7 inflammatory markers. Could you just briefly tell us those markers? Number 2, what is the role of aspirin? Because the cardiologists push it. And number 3, can you just address triglycerides and what's the best way to get it down and what's that role?
Okay. Thank you. And so first question, if you want to, you can feel inflammation, but if you want to measure it, and I will say there is a difference between inflammation related to rheumatoid arthritis and the inflammation we measure in an advanced cardiology clinic that's felt to be actually inflammation in blood vessels. So I do send blood work to Quest. Again, I can't own them. They're a $6 billion company. But Quest offers, they measure the HSCRP. You saw that on slides, high sensitivity C-reactive protein. There's one called MPO, myeloperoxidase. Myelo usually means something with the blood cells. There's one called LPPLA2. It's all on a panel. There's one called oxidized LDL. There's a urine test for small amounts of protein called MACR. And then there's a urine test for oxidative stress. It's a complete panel. You don't necessarily need all of them. Very often one's abnormal and two are normal or some combination. So I like a little more comprehensive panel. And the thing is, they get better. You can see them improve with fitness, diet change, weight loss, better dental health. I keep bringing that up. It's really important. Can't believe how many patients, it's been 4 years since I've been to the dentist. No. I'll tell you one other little pearl. I have these little strips I use in the office. You just put it on your saliva, and in about 15 seconds, the pinker it is, the more nitric oxide exists in your saliva because you're eating your leafy greens, and you're eating your beets, and you've got healthy bacteria on your tongue. But very often I test somebody because the more nitric oxide, the lower your blood pressure, the healthier your arteries, the better your sexual response. And I see no nitric oxide, and I ask the question, by any chance you're using Listerine or Scope? And 9 times out of 10, they pull out of their pocket those little Listerine, breath freshener little plastic things, which are rather unpleasant anyways because of the chemicals in them. But it turns out antibacterial mouthwashes that are available in the general public kill important bacteria in your mouth, so you can't make nitric oxide in your saliva. And it's like a light bulb goes off. I have a few examples of some natural one. There's one called Hello. It's a mouthwash without antibacterials. And they come back and it's better. And sometimes their blood pressure is actually better. So cool little thing. Number 2 was aspirin or not. Well, number 1, there absolutely are people who need aspirin. The most important group, if you've had a heart stent in the last 12 months, there's nothing natural that replaces aspirin. And in fact, you're going to be on 2 drugs, aspirin plus Brilinta, aspirin plus clopidogrel, aspirin plus Effiant. If you don't take those drugs, you risk your stent clotting off, which could be lethal. So I also deal with it in the clinic. Doc, I'm taking garlic and it's a blood thinner, even though I had a stent 3 weeks ago. That's when I lose it. Because you don't want to die because you think garlic's better than aspirin. Garlic may work, but we've never studied it. Or I'm a big fan of nattokinase. Some of you know what it is. Or lumbrokinase, but that comes from earthworms, so I don't use that. But nattokinase comes from soy. But there's no data you can use nattokinase to protect your stent. I use it in other situations. So those people always need aspirin. In late 2018, 3 studies were published in the same month, September, that in total were 45,000 people in aspirin studies. These are expensive, huge studies. One was a group of healthy diabetics, one was a group of healthy 50-year-olds, one was a group of healthy people over age 70. In none of those studies did it come out that just taking a daily aspirin as a general tonic was better than not taking it. Sometimes the stroke and heart attack rate went down, but the stomach bleeding rate went up. So out of that have come a zillion headlines and new guidelines. The general public doesn't need a baby aspirin. It never was about, I've had a bypass, I've had a stent, I had a heart attack 4 weeks ago. You need an 81 milligram aspirin. I like natural blood thinners. I can't use them in atrial fibrillation either because despite, vitamin E and other things, it's very litigious to take a person with atrial fibrillation and not use Xarelto or Eliquis because they're amazingly effective and really quite safe. But I haven't convinced all my patients of the sanity of embracing some pharmacologic agents. Third question was triglycerides. Triglycerides matter. The reason doctors are excited again, there's a fish oil substance called Vascepa, 4 grams a day, that now is FDA approved, lowers triglycerides and seems to reduce heart attack events. I mean, eating plant-based, whole food sometimes lowers triglyceride, not always. If you're aware of Dr. Esselstyn, Dr. Ornish, and other data, sometimes triglycerides actually go up a little bit while the arteries are cleaning up. So I don't focus that much. Pre-diabetes, the so-called metabolic syndrome. Get to the gym, lose a couple pounds, eat those omega-3 precursors, chia seeds, flax seeds. Very often triglycerides come down. But cardiology has been focusing on LDL, 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 and I think soon lipoprotein little a as the 1 or 2 most important cholesterol particles. Yes, in the back. Oh, okay, we're done? Oh, cool. This has been so much fun. Thank you.